everything's all good, got the wall, transverse D tinted, 72, etc. I do want to point out that when I set it at 17 by 14, it's too small on this. So make sure if you're doing a 14 by 17 crosswise, you have it open here. So if you don't want to pay attention to those, it's a little off, just make sure you have it open. If I'm doing a 14 by 17 crosswise, which I'm going to do U crosswise, so that's 14, 17, 14, 17. So if I'm doing a 14 by 17 crosswise, I got my 17. It's just a little bit off on this, so just make sure. So I'll read through this real quick. So PA, select the correct size image receptor, normally 14 by 17 for most adults, adjusted to 14 by 17 on the collimator. So this is what I kind of want to talk about real quick before we kind of get into the positioning. So really on this, with everybody, so everybody does chest x-rays a little bit differently. So usually most guys, I would say you're going to do crosswise. Guys usually have broader shoulders and you're going to do crosswise. When it comes to females, I kind of had a conversation with Janice about this. We kind of do ours the same way. With females, most of the time we're going to do it crosswise unless their body frame is very tall and lengthy and they're going to easily fit on a lengthwise. I'd probably turn around real quick. I would probably do you lengthwise. You would honestly fit lengthwise or crosswise. Like with y'all, I don't think y'all would fit lengthwise because guys have broader shoulders. So with y'all, I would definitely do y'all crosswise. With her, I could either probably do both. I'd probably do her lengthwise. So me and Janice kind of agree with that normally we do most people crosswise unless body shapes is very small, lengthy, do them lengthwise. The other girl who I worked with, she did most women lengthwise and most guys crosswise. So she was kind of automatically, if she's doing a girl, she would do them lengthwise. A girl should fit lengthwise, but me and Janice kind of usually do more stuff crosswise.
And so what's fitting in that? You're just talking about the lungs?
Lungs.
Okay.
Lungs. So that's the main thing, trying to get all your lungs. So this can be a little bit different. So depending on who your patient is, depends on crosswise versus lengthwise. Is this my paper?
No, you never grabbed one, but you can use it.
Okay. So, place a right or left marker on the correct side of the image receptor. Sorry,
No. I think she was just going to see you.
Oh.
So I always use a left marker because when we do the lateral, we always do a left lateral. So I already have my marker there ready to go. I usually put my marker like this. I know some clinical sites maybe don't like that or something. But really, a lot of times your shoulder slants like that. So I kind of follow with the slant of the shoulder. Either way, it's fine. But I use the left marker. Have the patient stand erect, anterior surface of the vertical grid device, mid-sagittal plane right in the center. Have the patient spread their feet slightly to give a broader base of supports. Adjust the height so that the image receptor will be centered at T7. So that's the centering point for your chest x-ray. We'll kind of get into this here in a second. That's going to be the inferior angle of the scapula. So the bottom of we felt a lot of the bottom of the scapula last semester. Bottom of the scapula is going to be at the level of T7. Patient depress their shoulders, ensure they're at the same level. Roll the shoulders forward. Why would we roll the shoulders forward? Why do y'all think we would do that?
Fit.
Say that again.
To fit everything, or no?
What happens when you roll your shoulders forward?
Pushes out your spine. Or
I don't know.
They moved your scapula out of the lung field. That's a big evaluation criteria of the chest. You don't want that scapula in the lung field. It could be blocking something. So roll the patients forward, check the SC joints for rotation, adjust if needed. So I want to make sure they're nice and straight. I don't want them rotated one way or another. Shield, the image receptor should be about 1.5 to 2 inches above the top of the shoulders. Breathing instructions are so important on this. Make the exposure on the second full inspiration. So I'm going to tell you, take a breath in, blow it all the way out. One more big deep breath in and hold it. Expose. After exposure, tell the patient to breathe. So go ahead and put your chest up against the board for me. Good. So what I'm going to do, I usually look at the light here, and I just want like a little bit of light above his shoulders. Nose down just a little bit more. So I'm gonna have a little bit of light above his shoulders, just making sure I'm getting everything. Go ahead and roll your shoulders forward for me. Good. One thing I do that I don't talk about on the paper, just make sure you don't want like soft tissue in the lung field. So I just pull the arms out just a little bit. A little bit more. Yeah. There. Good. Take a little step to your yeah. Right in the middle there. Good. Raise this up just a hair. Scoot to the left for me real quick. A little bit more. Back. Shoulders roll forward. Have a little bit of room above the shoulders right there. Go ahead and take a breath in. Blow it all the way out. One more big deep breath in and hold it. Expose. You can breathe. Work both ways. I'm going to do lengthwise just to kind of show the difference though. Do lengthwise. Chest up against the leg for me. So on her, especially doing it lengthwise, don't like skim so close on the top. I have about 2 inches above the top. There's her crest right there. I'm not gonna have, lungs are never gonna be below your crest. So I'm definitely getting everything right there. That's good. Definitely have enough room at the top. Give yourself a little bit more wiggle room. Now that I did lengthwise, I have 3 more inches this way. Don't try to cut it so far at the top. So, go ahead and take a breath in, blow it all the way out. One more big deep breath in and hold it. Expose, you can breathe. So on her, that just gives a little bit of difference just because if you crosswise, have a little bit of room above the shoulders. Her lengthwise, I can bring it a little bit more, have a little bit more wiggle room. Top bottom of the light was like right out of press. I for sure got it. Oh, especially if you're doing guys, especially, and the guys have a lot of muscle up here, think about that. If it says to put the image receptor 1.5 to 2 inches above the shoulder, think about that. If I have like this much muscle, and then I put it 1 to 2 inches above that, I might cut off the bottom of the lung. So that 1 to 2 inches, I feel 1.5 to 2 inches is kind of a guideline. Be careful. So people who are a little bit more muscular, maybe don't have so much room at the top.
But you can also feel, I mean, it doesn't matter the muscle, right? When you shoot through it, you can feel, and we're just going for bones. That's just soft tissue, right?
Yeah,
It's
yeah.
like, we treat it like fat.
Yeah, yeah. Sometimes it's easier to say that than done because you're like, oh, there's her shoulder, let me go, and then you end up cutting the bottom because it's so dry. So, yeah. That I turn to the side, they're gonna be long. So when I'm straight forward, you're more wide, one to the side, I'm more long. Everybody's 14 by 17 lengthwise. No matter if I did him crosswise, now I'm about to do it lengthwise. So just be careful when you're comping. You do a lateral, watch that collimation. So, place a left or right marker on the image receptor according to the lateral being performed. So when we do chest x-rays, 99.9% of the time you're going to do a left lateral, and that's because it's getting your heart closer to the image receptor, and therefore it reduces magnification. You don't want that heart to look enlarged. So we usually do a left lateral. I usually move my marker in the front just because when I'm standing right there, your chest kind of goes in right here, your back's kind of bigger, so you do have a little bit of room there in the front. So I usually put my marker, I just move it from over here to over here. Have the patient stand with their side against the vertical grid device, center the mid-coronal plane to the midline of the image receptor holder. Mid-sagittal plane should be parallel to the image receptor, mid-coronal, perpendicular. Have the patient grasp their elbows and raise their arms upward as high as possible so they're out of the chest area. Check for rotation, center the perpendicular central ray to the level of T7. Upper border an inch to 2 inches above the shoulders. So, this is a little bit for her. And honestly, when you're going from a PA to lateral, you really, if anything, you might move it up just a hair. I'm still doing the same person. You really didn't get any taller standing to the side. So usually you don't really have to move it like at all. Usually it fits. If anything, I might adjust it a hair. So go ahead and put your side, your shoulder gets more facing me, and then I always kind of say with both arms, kind of raise your arms up like this for me. So if you want to put your hands on top of your head, that kind of relaxes them, and then you can, if you want to bring your arms together, that just kind of helps you get, if you kind of do like this, just kind of helps your shoulders get closer to the board. If my arms are out like this, if my arms are out like this, I can't get as close to the board as possible. If I put them in, I can get real close to the board. Good, yeah. Take a little step back.
Right
there. So boom, I'm right on his mid-sagittal plane, right there. Sorry, mid-coronal plane right there. Boom, arms up out of the way. Good, got everything. One thing I do too, always kind of put my hand on her back like that, just to make sure everything's nice and straight. I don't want them, if he was like this, my hand would go like that, he's rotated. So, back, always kind of, good, good. All right, go ahead and take a breath in, blow it all the way out. One more big deep breath in and hold it. As you can breathe. I remember like last semester y'all asked me about what this is for, and this is also for chest x-rays. This is kind of the thing, I really don't use it unless I really have to. Like you can stand here by yourself, I don't think you're about to fall on me. If someone really needs this, go ahead and reach up and grab. And then it kind of depends, if you're tall enough, grab that. We probably need to grab the smaller ones. So that just kind of gives you some balance as well. Take a little step towards the board. Good. Back. So if you need to use that, you can. It's to me, I really don't use it unless I feel like you need that stability. All y'all can do it without holding it. If you want to use it, you can. I usually don't use it, but it's kind of I might need to adjust it here in a second. We'll do that when I get there. This, you really got to manhandle this. If I want it, the machine in there, it glides so easily. If I want it to face him, I really kind of got to get it where I want it to go. So one thing I'm going to do first, get my distance. A little far. So what I'm gonna do is go perpendicular to his sternum. So if I picture this coming out right there, boom, perpendicular. You can see it's a pretty small angle. It's not, and it's one of those things I'm not gonna be like, it's 10, it's 15. There's not a certain angle. It's just to their sternum and how they're sitting up. So I have, you know, here would be straight. I have just a little angle, so that's coming down perpendicular. Let me turn the light out real quick so we can see a little better. I feel like I have too much above his shoulders. Raise up real quick and I'll lower this down just a little bit. I'm gonna go back and check it on him and see. It's pretty. So y'all come back and look at my tube real quick. This is one thing I really want y'all to get. Do you see how that tube, it's going right towards him? Y'all see that? So, got my marker. So,
Repeat.
I know. And honestly too, when I do this, I really don't look at these numbers. I just kind of open my collimation to where it fits the board right there. Raise your arm up and lean a little bit to that side. A little bit more. So there's that line. Y'all see that line right there? I'm a little bit low, so I'm gonna raise that up
Thinking that too.
just a little bit and come back.
Plus the bald head.
Raise that up just a little bit. I'll lay down. There.
You said you look like an actual mannequin.
Oh, no. Thanks.
All right, go ahead and take a breath in. Blow it all the way out. One more big deep breath in and hold it. Good. Suppose you can breathe. So on this too, really, it's gonna take a little bit too, and it's okay if you go back in there and check that a couple times. As long as I look at this and it looks like it's going towards him, if you look at this tube, and when I went over there, I mean, if I look at this light, I'm like, all right, it looks good and everything. But then when I come over here and look, it's kind of coming this way and everything. I mean, we can be real dramatic with it. Like looking at the light, I'm like, oh, it looks pretty decent, but it's probably going like that. So just go back there, just make sure that tube is going right towards them.
D40.
Yeah. But if you really look, I mean, I really kind of just eyeball it and open it, but the numbers are exactly the same as it all is in there. 40, 60, 80, same thing as that other room. So you got the light, push this to drive it. If y'all want to kind of drive it around the room, it's fine too. If y'all want to move the stretcher where it's set up in different places, kind of have the room in here. Patient place their back against the image receptor holder and remain, it says like remain there for several minutes to allow air to rise and fluid to fall. I mean, honestly, like you should stand there for 5 minutes, but I'm stand them up, go. Place the center of the image receptor 2 inches above the iliac crest or high enough to include the diaphragm. Center the mid-sagittal plane to the patient. We'll talk about the bladder, honestly, on the supine. It says some radiologists may prefer to use 2 radiographs using 14 by 17 IR, place them crosswise, and center one high enough to include the diaphragm and the other low enough to include the pubic symphysis. honestly, if you're patient, like everybody in y'all's class, we're gonna do lengthwise. Y'all are all small. But if you have a patient who is really big, you wanna get their whole abdomen, you wanna get from like flank to flank. So basically, if you had a bigger patient, you would do 2 crosswise images so they fit better. So everybody in y'all's class, we're gonna do lengthwise, it fits, but just to know, and I'll talk about that again tomorrow, bigger patients, wider abdomens, I would do 2 crosswise just to make sure I get the whole abdomen from side to side. Perpendicular beam, right or left marker. So breathing, same thing like the chest is super important. We're gonna take a breath in, blow it all the way out and hold it. So what happens to your diaphragm when you take a breath out? It goes up. So now I'm gonna see my abdomen really well. So if I took a breath in, kind of think about it's like kind of scrunching the abdominal contents. If I take a breath out, my diaphragm comes up, really opens up that abdomen. So, upright abdomens are super easy because I have an easy trick for them. So, take a little step to your right. So, abdomen, upright abdomen. What you need to do on an upright abdomen is get the diaphragm. So, the center needs to be 2 inches above, center of the image receptor 2 inches above the top of the crest. I mean, y'all are small, y'all are easy to feel the top of the crest and do that, whatever. Trick for this is, put the top of that light right there in the armpit, right there, and let it fall. You'll get the diaphragm every time. So that's super easy on, because sometimes I feel like it's a lot easier to feel on people because your abdomen kind of goes out when you lay down. So it's a lot, some people, I mean, I could easily feel on the top of your crest, but sometimes it's hard when you're standing up. Let's make it easy. Let's do a trick. I put that light right in the middle, right in that armpit, let it fall, line this up, make sure that's right. Mid-sagittal plane, 14 by 17, go ahead and take a breath in, blow it all the way out, hold it, expose so you can breathe, and relax. Say armpit, so boom, right there, right in the armpit, let it fall, I'm gonna hit your diaphragm every time. And I go to do you laying down on the center lower, make sure to get through the symphysis. So that's upright. Any questions on that? Pretty straightforward.
You said take a deep breath in, blow it out, and hold it.
We're going to go over to the table. That image receptor, I usually try not to put it on the other side just to make sure it doesn't get lost. Also too, I usually don't put it up here on either one, honestly. If I put it up top on like the first one up there, if that marker got in the abdomen, I would cut something off. Or I might have the marker in the anatomy, so I like to put it on the bottom. If I do get the marker in the anatomy at the bottom over there, I'm about to do it again, I'll see that spot right there. So, same marker at the bottom, you go ahead and lay back. So I'm going to get this all set up for table Bucky. So I'm good, got table Bucky, transverse detent, got my distance all lined up. So, read this real quick. So, line the table supine, arms down by their sides, place a support under the knees for strain relief. So if you need it, I could put something. I don't want to bend your knees up too much because I don't want to squish your abdomen really. But if you needed something, I could put something like real small like that under your knees if I needed. Honestly, this is gonna be so quick. I usually don't if I need it. Okay, but 14 by 17 lengthwise. Same thing again. Wider patient, I would do 2 crosswise, 1 high, 1 low. Kind of the same thing like the tip bib. Make sure I have some overlap. So center mid-sagittal plane, got my marker, perpendicular beam. So when I do the supine abdomen, I want to make sure I include my pubic symphysis. check for rotation, hips, expose on and expiration. So I'm gonna make sure too, I'm gonna just kind of look at him, make sure he's nice and straight, he looks good, he looks straight. So on this, I'm gonna press on him, I'm gonna center at the top of the crest on this one. So I'm gonna press. So we found ASIS last time, so kind of find that, curve around, there's top of the crest, right there. I'm gonna center it, it's mid-sagittal plane. I always kind of push back on it, there I'm pushing on top of this crest right there. Follow it all the way over to the side right there, push back on it, good. I want to check, because I think I look good from here, but I kind of just want to check it the other way, just make sure I look good. In the center of abdomen, I'm all good. Go ahead and take a breath in, blow it all the way out, hold it out, expose. So there's your supine abdomen. So one thing I want to mention too, so on the supine abdomen, you're supposed to get all the way to the pubic symphysis. So y'all know the pubic symphysis, bottom of pelvis. So if I shot that out and I looked at your radiograph, if people who are like aesthetic, their abdomen's going to be, if you have a longer abdomen, you might not get the bottom of the pubic symphysis. When I shoot that out, if I don't see the bottom of the pubic symphysis, what I'm going to do is shoot a bladder shot. So I'll shoot a bladder shot to make sure I get the bottom of the pubic symphysis. So to shoot a bladder shot, let's just say, pretend I have in there bladder shot, I just need to get the little bladder. Because basically, I'm going to have it, I might cut off the pubic symphysis, so I need to shoot a bladder shot. So I'm going to use this 10 by 12 crosswise. So 10 by 12 crosswise, so there's 12, there's 10. So what I'm going to do, technically in the book it says go from the pubic symphysis and go 2 inches up. We talked about pubic symphysis. I'm going to find his ASIS and go 2 inches down. So let's say I shot it out, bottom of the pubic symphysis cut off. Let me shoot a bladder shot real quick. So I'm going to find ASIS and center that 2 inches down, right on that mid-sagittal plane. So that is also something you can do. That's kind of a supplement. Let me shoot that out if I don't get the pubic symphysis, because I need to see the pubic symphysis on the supine. If I don't, if I clip it or abdomen's too long, I'm going to find ASIS, go 2 inches down, center it, 10 by 12 crosswise. Same thing, expiration, expose.
So when you do abdomen though, you're gonna do both of these, not this one, but just the supine and the upright.
Like when you do abdomen, like in clinical setting?
Yeah. Are you gonna do? You're gonna do both? Have them up on the bucket and then on the table?
There's like actually 3 ways to do an abdomen to be ordered. We'll talk about all this tomorrow, but there's actually an acute abdominal series where you do a PHS, an upright and supine. You can do a 2-view abdomen, upright supine, or a 1-view abdomen is just supine.
Okay.
So it depends what they order. Sometimes people just want to do quick. Sometimes they'll do both. Sometimes if something's kind of else is going on, they'll do the chest too.
Oh.
So on this abdomen is a bigger part, so I want to use a grid. So this right here, we kind of talked about this last semester. This is a grid cap. So kind of tough, but you kind of slide it back that way and it pops in. So I got my image receptor in my grid. So y'all, anybody's abdomen in your class, big part, need to use a grid. So the hardest part of this, kind of like the math, the hardest part is setting it up. Hardest part is making sure it's underneath the patient really well and properly. So I did this to make it easier for y'all because y'all see on like the grid, there's not like the middle tick mark right there. So that's the tick mark right there. What I'm trying to do is get that pretty close because I want it to be centered at the top of this crest. I want to try to go in with that at the top of this crest. So go ahead and lay down for me. So what I'm gonna do is, I'm gonna lower this down real quick. So what I'm gonna do is try to get this as close as possible to his crest. Right there. I can make another tick mark on this side too, if that's kind of helpful. But I'm trying to get that as close as possible to his crest. So go ahead and put your arm over your chest. Raise this knee up and turn up for me. I'm gonna put that as far over as I can get right there. Do that, check. Just a hair. See, I'm pretty close. That midline. Go ahead and roll back. Good. So stay right there real quick. So let's kind of act like, yeah, maybe your movement's not great. So, okay, you're kind of on the board, but you see he's hanging off. I'm gonna come over to the other side. I'm gonna lower this down. Notice how I'll put that back up when I move over here. Go ahead and bend this knee up for me. Put this and roll up on that side. What I'm gonna do, shimmy this over. Go ahead and roll back down. Okay, now he's more on the board. He's not hanging off the board. So now he can scoot for me. Scoot just a little bit, yep, that way. So also too, I can kind of look, put the hands on the side. Hey, got a little bit. I feel like I'm pretty even right there. So I'm good with how I put it under there. So that's just kind of putting it. There's that tick mark right there. There's the top of his crest. I'm pretty good. So as long as you're pretty close, I'm good. Now the only thing I need to do is get this even with his abdomen. Basically just gonna line this up to the image receptor. So it's a lot easier on this one. I don't have to get that weird angle or anything. I'll get my distance, 40. I'm good, my 41, 42. Just wanna make sure this is nice and straight coming down towards him. It's not one way or another. And then I'm just gonna line this up. To his image, to his abdomen. So I'm at the top of this crest, midline, good. I'm pretty much centered too. I kind of looking at that tick mark too, center to that tick mark, center to him. I forgot my marker, but I would put a marker down there at the corner before I put it under him, right there. Same breathing, go ahead and take a breath in, blow the way out, expose.
As long as you mark one side or the other.
Yeah, because you see both sides. Since you see your spine, you see both sides. So, kind of just moved this. I just kind of maneuvered this till I got this where I wanted it. So, I got him under the board, and if y'all need to kind of scoot for each other, that's fine. I kind of just wanted to make a point that way, that like if he couldn't move or whatever, I need to turn him up the other way, kind of shimmy it, because it's always gonna be on this kind of soft board. Kind of shimmy it under, he rolled back, and then he could kind of scoot for me. So, center the crest, midline, 40, I need my marker, good to go. Hardest part of that is getting it under him and getting it well. Also too, if you kinda got it under him, I mean, if he's close to his abdomen, I'm okay with it, but if you got it under him and then like the tip mark here is like way up here, way down here, just restart over. Cause it's really hard to move it's easy to move that board like side to side, but moving it up and down, that's hard. You almost just need to start over. Portable abdomen's not as common as portable chest, but you might see it.